Hey everyone, this is Victor from Cyborg for Life, and I want to welcome you to episode 142 of Limb Lengthening Live, where the patients interview the guests. And today we're doing a different style of interview. Typically, we talk about limb lengthening, deformity correction, stature length, and all that fun stuff. But now we're going to kind of slide the timeline forward a little bit. We're going to talk about post-op, post-surgical recovery. And today, well, you all know we have Dr. Craig Robbins, one of the best limb lengthening surgeons in the world, but he brought one of his friends and colleagues here with him, Dr. Scott Willis. Hey, Dr. Willis, how are you?
How you guys doing?
Doing great, doing great. All right. So, guys, if you don't know Dr. Willis, he is an emergency physician, an ER physician, and he has extensive experience in men's health, hormone optimization, peptide therapy. I think he started a business with his wife, which he's going to talk a little bit about. So, Dr. Willis, if you don't mind introducing yourself a little bit.
Sure. I'm Scott Willis. I board certified emergency physician, but obviously in this role, we're going a little outside of the emergency role. Been very interested in all things hormone optimization, generally from the male's perspective of male TRT. With this business that my wife and I have gotten into, we've gone into the peptide world. So it's an exciting, crazy world with lots of benefits and lots of things that are exciting to talk about. It's I think there's a lot of interesting stuff coming down the road. And I think right now they're in the space that we are talking about tonight. I think there's a lot of places to be for the peptides to be used to optimize your recovery in these surgeries.
Yeah, I find it so interesting because, having been in the space with, surgeries, orthopedic surgeries, there's recovery is everything. And Dr. Robbins knows, people ask him all the time, like, what about the peptides? And he went on like a excavation recently, just like, I'm going to find everything I need to know about peptides to talk about it. And he has an expert here. So let's go ahead and bring up a presentation.
Just to say, Scott and I have known each other a long time. We were in medical school together, but we have no business affiliation. This is purely for information. I am not recommending this. This is just a resource for you. And when Victor asks, what do I think about peptides? My standard answer is, to my knowledge, everybody is healing anyway, so why do they need it? Yeah. And that's a very simplistic answer. The point being, most of these patients are very healthy. We're helping with nutrition, all that kind of stuff. But just because they're healing doesn't mean they can't heal better or faster or have quicker recovery, muscle mass. And I don't know these things, but Dr. Willis does. So I'm sort of in the background here. I'm going to learn just like you. So thanks for being here, Scott.
We're going to get a peptides masterclass. So
that's right. That's right.
All right, guys. So this is Peptides for Post-Surgery Recovery, Faster Healing and Optimized Recovery with Dr. Scott Willis and Dr. Craig Robbins. So I just kind of jump right into it. We're going to go into the questions that I get asked all the time, and I kind of consolidated them here for you. So the first question, the most basic question is, what are peptides, and how do they work in the body in relation to recovery?
All right, so the real simple thing is a peptide is a chain of amino acids. It's a protein. So we have tons of these. We have them in all aspects of our life. We have them in a lot of medications. The one that everybody knows is insulin. Insulin is probably the first peptide medication that was developed. We've come a long way. We have a lot of medications now in the weight loss space, which are also peptides. The Ozempics of the world and the Wegovy's and the Mounjaros, those are all peptide medications as well. And then we have the sort of fringe world that's happening now. So, and it's not really fringe, but what it is it's the frontier. So there are peptides that are in prescription medications, and there are prescriptions that are, or there are peptides that are not yet ready for the big drug companies. So what are they? So they very simply, they are the chain of amino acids. How do they work? They interact with tissues in different ways, usually via receptors, and they usually cause some other effect via that receptor. So, the example is, we'll use insulin because most people are familiar with that, but insulin causes, at the insulin receptor on the muscles for blood glucose to be go into the muscle tissue and be utilized for energy. So that's the simplistic way of talking about that. We talk about we'll talk about other ones specifically, but in terms of recovery and recovery from surgical procedures, which is, a surgical procedure is basically an injury. It's an injury just like, if you break your leg doing, going out and slipping on the ice or breaking a hip or doing all those other things. It's exactly the same thing. It's just a controlled trauma, if you will. But recovering from that is like Dr. Robbins said, you recover from that regardless. How does this help? Well, various things, growth factors that help the body move the things into the area that is healing, that allow it to repair. Anti-inflammatory type of peptides, which would help, decrease the inflammation in the area, which again would allow the repairing things to go in there. And then other growth factors that are just going to, speed that up. We'll talk more about things like growth hormone and testosterone later on, but some of these work synergistically with that. Some of them help your body produce more of the things like growth hormone. So there's a lot of things that are going to happen. We're going to a few of the peptides that we're going to talk about specifically for recovery, and I think you'll find them pretty interesting.
Sounds good. I love it. Now, we were just kind of like to segue into this with the role in recovery. Like the most popular peptides that I hear about all the time are the BPC 157. When I tore my pec tendon benching, I think it was in early 2022, and I was looking for anything that I can help me recover faster. People were saying, oh, take some BPC 157. I was like, what is that? And they said that it had some angiogenic properties. I looked into it briefly. So if you can kind of help explain what is that and what is TB 500 and how do they help with post-surgical healing and what makes them so effective?
So these are the most popular recovery or injury peptides. The Wolverine stack, which is the BPC 157, TB 500 together individually. So BPC 157 BPC is body protective compound. Why 157? Who knows? But it's derived from gastric juice. It helps, a lot of these, if you read about a lot of these peptide medications, they have a variety of effects. The effect that is leveraged with BPC 157 in healing is in angiogenesis. So basically what it does, allows more blood to get into the area of the injury. There's something about this which I found kind of interesting, and I first learned about BPC, which was you're supposed to do the injection over the site of injury, which I never really understood why. And I'm not really sure I still understand why, but I've tried it both ways. I've tried it just as a regular injection and tried the injection the way you're supposed to do it. And it works better when you get it close to the injury. I'm not sure why, but it does. So that's the main effect. That also has anti-inflammatory effects. And, we can talk about dosing schemes if we want, but this is a very powerful and effective healing medication, because you can't really call it an anti-inflammatory like Motrin or anything like that, because it's not. It's a healing medication. There's the studies that they have done on animals. They have shown the ability to regenerate tendon, which is I don't know how you do that. Like this is almost like magic that it works. But you've tried it. I mean, it works. I mean, it's like it's available with a shot, and you can also get an oral version of this. I have tried the oral version, and it doesn't work quite as well, but it's also, because it's derived from a gastric peptide, it's found to be stable in gastric juice. So you can get by with some taking this orally. So it's really interesting molecule. Unfortunately, I picked up my little FDA thing here, and BPC 157 is on the list of no drugs. So you mind if I take like a second and just talk about this?
Yeah.
So in last year, and I'm sure everybody's really aware of this, is that the FDA decided that they would make that compounding pharmacies that were making these medications needed to be, I don't know, they needed more evaluation for safety. The wording of this whole thing is very strange. So basically what they did is they gave a list of these medications that were, a lot of them were the ones that compounding pharmacies were making, and put them on this list that basically said they raise significant safety risks. They don't say what the safety risks are, but they say that they're safety risks. So the compounding pharmacies stop making them because they're afraid that the FDA is going to come in and shut them down for making something that's unsafe. It's interesting with the very first medication on the list is BPC 157. And BPC 157 is probably the most used of all of the peptide medications out there. I mean, the word is out in all athletics that it's the healing peptide. It's what makes you better if you're injured, and it's incredibly safe. It's basically your own gastric juice. So if your own gastric juice is not killing you, I'm pretty sure that the stuff made from it is not going to kill you either. But they said that it is not, they can't guarantee that it's safe. The other thing that's kind of interesting, and I don't like to get into conspiracy theories, but it's interesting that all of these medications that are on this list are the ones that really work, which I found kind of interesting, but we don't need to go any further. But regardless, PBC 157 is still sourceable. The problem is that it is where, and there are some very trustworthy non-US compounding pharmacies that are producing it, and that's where I'm getting the meds for my clients. So the stuff works. It helps out. It helps with injury, and it doesn't give you all the bad things that go along with, a long course of NSAIDs. It's like NSAIDs, they tear you up if you're on them for a long time. So anyway, that's my sort of diatribe on the BPC and the availability of it. Now, TB500 is a little.
So you're actually saying that they actually banned BPC 157 in the US?
This is not banned.
Okay.
It's been put on a list that says there's significant safety concerns.
Okay.
They don't really say what that means.
Well, they're going to leave it up to the interpretation of the customer, and people are going to oh, that's dangerous. Let me not buy that.
It depends how much you want to trust the FDA for that. Because
well, if they're not going to make it, then you can't get it. If you can't get it, you can't use it.
That's interesting.
I've heard Lane Norton talk about this, and he says he has well-positioned clients in decisions of authority within regulatory agencies, and that this is probably going to go away soon, whatever that means. And I may be saying who said that as opposed to one of the other guys I've listened to, but this is a very hot topic at high levels for many reasons. Financial, I'm sure, is one of them.
And I do believe that our next Health and Human Services Secretary will probably aid in making them do the right thing. I'm guessing. So I know. But anyway, so like I said, it's you can still get it. It's just that if you are, you start going in that sort of gray market of the research chemicals, and you don't know really what you're getting. I don't know. It just gets a little scary there.
Fuzzy area, yeah. Okay. All right. So you were talking about TB 500 here.
Yeah, TB 500 is thymosin beta. So that is a completely different mechanism of action, and that is more of a tissue anti-inflammatory / has some growth hormone effects, But basically in combination, you can use it by itself, and that medication is not on that list, which is kind of interesting. So, it works well. It is more of it's more of an anti-inflammatory type of thing, but in combination, those two medications are phenomenal. They hit the injury from multiple angles, and then you run it for a month, and you'll find that you'll be repaired very quickly.
So here's my question: if these are used to help with healing, but it has some anti-inflammatory properties, isn't inflammation important for healing? Because we like to say, and it may be a gross oversimplification, avoid NSAIDs because inflammation is part of healing, and you're going to compromise it. Well, I'm guessing at least anecdotally, if not proven for at least athletic or soft tissue injuries, there's no deleterious effects. I don't know if there's any bone or human bone studies showing whatever. Maybe you know that.
Yeah, I mean, this is going to be part of the effect. So, it's not going to be like taking an NSAID or a steroid or something, a corticosteroid or something like that. But it's going, the synergy between these two things is one brings more blood into the area, and then your TB500 is bringing more growth factors into the area. So, it's kind of like, yeah, there's anti-inflammatory properties to it, but really you're using it more for the growth factor migration.
Angiogenic and catabolic or anabolic.
Well, it's not really anabolic. I mean, it's not catabolic like a corticosteroid. It's not anabolic. It's not really building tissue. It's really, aiding. It's getting the modulator, the repair modulators in there so that it can do what it needs to do. So, you have a tissue injury of whatever you have, like you're in this case a bone injury. You want all of the things in there so you can increase osteoblast activity and stuff like that.
Very cool. Awesome.
This combination is it's a very powerful combination, and in terms of what it would do for in this type of a situation, it would be it should aid in the the repair, make it we talk about, again, you have young healthy people getting these surgeries. We're talking about optimization. We're not talking about we're not going to, it's not like you're going to take your 10-week recovery or 8-week recovery or 12-week recovery and making it into a week. It's like, we're going to keep the recovery is still going to be the same, but you're just going to have it. It's going to go better. It's just like, you're going to feel better while it's happening. You're going to have more optimal healing. And it's like, that's kind of what you're looking for here. You're looking to make it be the best you possibly can make it.
Right. And Dr. Willis, wouldn't you say, like, for less vascular, avascular tissue, like white tissue, like tendons, ligaments, whatnot, this BPC 157 is really effective because it does help that increase the angiogenesis with blood flow?
It's about everything, right? So, the tissues that heal the slowest are those, tendons and ligaments that don't have much blood flow. So you really want to get as much blood flow there as you possibly can. Now, there's a limit. Obviously, you can't give a gallon of this stuff and you're going to have all of that stuff go in there. But yeah, I mean, that should incrementally make things better with your healing process.
Very cool. Awesome. So now we want to kind of compare the two different, methods for recovery that people talk about: peptides, the new kid on the block, versus, the tried and true testosterone and growth hormone. What are the advantages, when we talk about peptides versus that, or are there, I guess, mutual benefits of both?
It's a good question. It's a good conversation to have. So peptides, the space that I work in a lot, I work with guys that are my age. I'm 60. So I work with guys that are 40 plus. So in terms of what you're doing in that space, so I'm just going to kind of do that first because I'll go back and do that. As we age, the ability of our body to do things changes. So we don't operate as efficiently and as well at 60 as we did at 40, as we did at 20, with everything. So it goes with hormone secretion, it goes with healing, it goes with everything. So peptides versus, let's just use growth hormone, because that's probably the most, will be most interesting to everybody that's watching this. So there's several peptides that are available that are growth hormone releasing hormone, growth hormone releasing peptide, what they call secretagogues. Basically, it makes your body secrete more growth hormone, and they work really well. Now, they work better if you have a good pituitary, if you are younger. So if you are able to produce a lot of growth hormone, these will optimize the amount of growth hormone that you can release. Exogenous growth hormone that you take, also extremely effective. If you have a person that doesn't secrete as well, it will work better because you'll get a better tissue level. You also have the ability to get super therapeutic, super physiologic. And is that helpful? Maybe. Is it good in combination to use growth hormone and a secretagogue? Maybe. There was the thought that always crosses your mind is with any exogenous substance that you put in your body through your feedback mechanism, will it shut down your natural production? Will your natural production start up when you stop taking it? And growth hormone is interesting because the studies have shown that it obviously, if you're the feedback loop while you're taking it is, stunted because you have these high levels, but your body starts producing it again right after you stop taking it, which is kind of interesting. It's not like testosterone. Testosterone takes, you got to jumpstart that when you're done. So we're looking, the one thing where, we'll talk testosterone next, but the growth hormone versus peptides, growth hormone, if you want to go more super physiologic, and you don't have to go high, the two units twice a day is probably as high as you're ever going to go. And, but versus a, growth hormone releasing hormone, tesamorelin, CJC 1295, ipamorelin combination, those type of things will, those secretagogues work great. And a lot of times that's the place where you start because, it's more natural, because you're stimulating your body to make its own production versus exogenous, which, it's, exogenous. It's a laboratory made. So then you look at also, I'm sorry, Craig, you were.
Is an analogy for that like Lance Armstrong? So you could take other people's blood and inject it into your vein to get more oxygen, or you could take epigen, a hormone, to make your body make more blood. So you're saying a secretagogue is a medication you can take and it tells your body to make more of its own growth hormone, as opposed to taking growth hormone from someone else that may feedback your body to stop making as much growth hormone. The end result is more hormone. One is your own and one is from somewhere else.
Yeah, exactly. And EPO, which you're talking about right there, is another peptide hormone. So, it's like you're taking something that is optimizing your own natural production. So yeah, it's great. It's a great thing. So again, there's like I said, there's pros and cons. And I think the only real con to a growth hormone releasing peptide is age. I think that's really all it is. And I think that probably in most people, it's the place to start because growth hormone has been sort of vilified and in the anti-aging world because it's people worry about it like causing tumor growth and all of these other things. And in reality, it's just that it's super expensive and it's effective, but the people that like in terms of what we're taking it for here, right? We're taking it for a healing benefit, which it's going to produce. It's going to help you heal from surgery better than if you didn't take it. I mean, that's the truth. And you're going to be on it for a finite period of time. people who are on it for anti-aging or for, body composition or for other things like that, it's a little bit different. But I think that honestly, in terms of this, the question here about which is better, I think either is fine. I think in younger patients, probably the peptide, the growth hormone releasing hormone is a better thing to start off with. And I think the cost is going to be a factor in a lot of people's decision about whether they want to use the peptide or the growth hormone releasing hormone, or whether they want to go full on growth hormone. But it's going to be individualized for the patient. So that's kind of where it is with that. Growth hormone is one thing. So the next thing is we're talking about testosterone. Testosterone is, it's a steroid sex hormone, and it's very different than your growth hormone. The functions are different. It's an anabolic hormone. Growth hormone will increase some muscle size. Will also increase bone size. Testosterone won't. But again, we're talking about aging here too. So I think younger patients, you don't need testosterone replacement unless you want it. You'll feel better on it, but how much is it going to affect your ability to recover from a surgery? Some, not as much as growth hormone. There's weight in it, and if you do blood work and you look at testosterone levels, we have trended downward as a population over the last 20 years. Is it important? Yeah, it is really important. But it's like you can manage that with things like Clomid if you wanted to try something just to boost your hormones a little bit. You certainly could go to a exogenous source, because that's really your only other choice, right? You could either go to something where you use a FSH stimulator like Clomid, and then which helps you naturally increase your level. Some people are more they respond to it better, or you could go full on like TRT, which will increase your levels. You will feel better. You will most likely be able to recover a little better. But I think that I don't think there's any risk to doing it. I think that it's absolutely fine if they want to do it. I'm not sure there's really any peptide sort of thing that'll increase your secretion of testosterone. You could, the FSH or LH kind of thing, that's really the only thing, but Clomid will help with that. That's not a peptide, but it is available, and we do use that in some cases.
That's interesting. That's really interesting, because I know that a lot of people, I've talked to patients that are, some of them are young physicians and whatnot. They're like, oh, I'm going to use testosterone, this, that, and the other. But you just pretty much said that growth hormone is more effective for tissue healing than testosterone. I know that I've come across some studies out there that said, testosterone has helped with fracture healing and whatnot, but growth hormone.
It's not going to hurt. Like, anytime, when I'm talking to people, I think it should be optimized. I think you're, as a man, I think you should have a testosterone level that is appropriate for you. Something that makes you, some of it is measurable and some of it's not. Some of it is, your cognition, it affects all of the different things. You're sleeping better, your cognition's better, your ability to, protein synthesis, to be able to take your amino acids and make them into muscle mass, or to be able to make them into bone, because there's protein that's going into the bone as well. Mm-hmm. So it's like there's lots of things that are good about optimizing that, and that's what we're talking about over the whole thing. Because if you look at what I believe in, and we can talk about all these specific things, but if you look at the body as a big picture, we just want it to be optimal. I'm not looking to be anything else. So if you're again, we're not going to make the healing go from 12 weeks to 1 week. We're going to make it go from 12 weeks to 12 weeks, but it's going to be better. You're going to feel better through the whole thing, and you're going to have a better outcome at the other side. So when you're doing therapy and physical therapy, you're more able to do it, and you get better results from it. It's all about being optimal.
Got it. That makes absolute sense. All right. So now you kind of talked about this a little earlier. I don't know if you want to kind of add anything to it, but with the recent FDA regulations, you kind of just said it. So you said that there can't, you know, I don't know if you said it earlier, but like Canada is one of the places.
Yeah.
Is it for, let's just say that somebody hears this podcast, a patient, prospective patient or something, I'm going to get surgery done or whatever, and I'm going to get some peptides, and they do go down the Google rabbit hole and they start looking for things. Is there any type of advice you can give somebody who doesn't know what they're looking for so that they can kind of at least find reputable sources of this stuff?
I think it's just, I think there is, there's a lot of information out there. I'm not sure how great it is. And you know, it's like anything that is cutting edge. We'll use that because that's the best way of putting it. I was going to say fringe or whatever, but sort of things that are outside of the actual, you know, normal things that we would do every day, that when you go to your primary care doctor, you know, it's buyer beware. You know, you got to be careful, and you do your due diligence, and you talk to people. And if you, I mean, I think any of this stuff should be done under a doctor's supervision, just because, again, I'll tell you what I tell my patients. I said, everything has side effects, right? So if you have me and you have a side effect and you contact me, I can handle any side effect, you know, and most of the side effects are not horrible. It's not like your head's going to explode or anything, but it's like, you know, you're going to have, you know, whatever it is, you know, and especially if you have any sort of underlying medical condition, we make sure that we, you know, do things safely. You know, it's all about that. You want to do these things in a way that they give you the benefit and you don't get any of the bad possible side effects from it. And then the other thing is that people, and this is another thing that happens a lot in this space, not just what you guys do, but in, you know, anybody that's into this kind of thing, is people tend to go crazy with it. You know, they get like, take too much, and you know, they think if, you know, 1 cc is good, you know, 10 cc's is better. You know, it's just you just got to be careful with that. So you know, you know, I know that there's a lot of these you know, research chemical companies out there, and I'm sure there's some that are very good. It's just, there's no way to tell. And I know that none of them are going into business thinking, I really want to hurt somebody. But I think you're only, you know, I think, you know, the things you just don't know with them is you don't know exactly what you're getting in the bottle. Like, and I think probably a lot of the companies are, you know, if you're buying BPC 157, you're getting BPC 157, but are you getting 5 milligrams of it? Are you getting 10? Are you getting, you know, 6 or 4? And you know, then there's also the, you know, the lab, you know, like how sterile the lab is. You know, I think probably the one thing about dealing with a compounding pharmacy is that, you know, all things being equal, they're going to probably have a little bit more consistency, and they're for sure going to have more, you know, safety, you know, the sterility and all of this sort of thing. Is it 100%? Nothing's 100%. So, you know, could you go online and go to a research chemical place and get absolutely perfect stuff that it works for you? Great. Sure. I mean, I'm sure you can. I think it's just about being, you know, trying to be safe. You know, the thing that the one thing that you know, I've been thinking about with this application is that you have to be careful of this. You have a surgical site that is open. You know, you've been open with bone exposed, and you know, the chance, you know, you don't want to get that infected. You don't want to mess that up. And you know, I think that there's, you know, obviously there's ways around anything. I think there's, you know, a little bit more, you know, risk with this that would say, yeah, you probably should have a physician monitoring you doing this. You know, it's like, you know, you just don't want to have the bad outcome here. If you mess up the surgical site is huge, you know, so we just don't want to do that.
Yeah. And you said it earlier that there is oral applications of this and injectables. I agree with you. I think that it should be administered via physician, but like for the patients who I've talked to, I tell them, I don't know anything about that stuff. I won't recommend it, suggest it or whatever. Yeah. But, you know, a lot of them will say, oh, I'm going to take it. I've taken it before. I'm like, okay, do you? But do you think that the injections are more effective than the orals? Is that what you said earlier?
Oh, yeah, for sure.
Okay. But Dr. Robbins,
I'd rather you inject your shoulder than your legs.
I was going to get your take on that.
Or whatever.
Yeah.
Please don't inject into your legs or your surgical.
Because of infection, is that the reason?
Yeah,
okay.
You use a bad needle, you forget to clean it, you get a little abscess, and then it seeds it. I mean, they're rare things.
I'm saying, you just got to be really careful with that.
Yeah.
So here's a theoretical question. So I have a 55-year-old guy who's pretty healthy, doesn't smoke, no real medical problems, but he's 55. He's not 35. Is he better off for the few months before optimizing testosterone, putting on some muscle mass? He's got limited time and resources, or is he going to be better off using this during the 3 months of lengthening, or after he's finished lengthening and now he's in the healing, getting back to normal phase? So like, you got limited time and funds. It'd be great if you could do all this stuff, but is there
which would be best? It'd probably be best to do it in the recovery phase.
Okay.
Your first scenario is like what I was thinking about when you started talking about that is you should do the whole thing. You should do it the whole time.
Sure.
But if you can't do it the whole time,
yeah.
In a 55-year-old guy that's healthy, I would go. I would go with BBC and TB500, but I would probably also just go straight growth hormone and straight testosterone, and just optimize him that way, because that's that's exactly what we're talking about. That's my patient population right there, because and he could be like incredible shape and exercises all the time and everything, and we're not looking at making him like a freaking bodybuilder. We're looking at making this guy get through the surgery unscathed. I want him to be able to hit the ground running, a year later, like that. This is big deal. This whole thing, right? It's tough on the body, and the best that you can do is make the body as resilient as you possibly can, so that when you're done, you are able to do all the stuff that you want to do, because you're doing this for a reason, right? You're not doing it just for shits and giggles, so to speak. Sorry if I'm not allowed to say that, but but you're doing it because you want to get an effect. So we're trying to get the effect and trying to have the minimize the collateral damage. Let's put it, that kind of thing. So that's the answer. With the answer to your question is after and real regular hormones, not like growth hormone releasing hormones, real growth hormone. And there's some other stuff here that I wanted to touch on before we get off. But
go.
Absolutely. All right. So we just kind of talked about this. We'll kind of probably skim over this one, but it's I guess
don't give away all your secrets, Scott.
Yeah, I know, because we'll plug you at the end there. You can see it at maximummedical.net. But if you want to kind of give an overview of how, let's say, a patient did come to you, and they're saying, "Hey, I did this procedure. I'm in my consolidation phase. Dr. Robbins clears them for full weight bearing or whatever, and they want to accelerate or improve or make more efficient their recovery." What would a typical, treatment protocol look like for that patient?
So, we could do, I try to keep everything simple. So my belief is that you should try and do the most with the least, right? So I always try and start off with as little as I possibly can. So, in this case, in not knowing anything else about this person, you do some blood work beforehand and everything, know a little bit more about them. But, if you have a typical person, young, healthy, we could do something like you do BPC 157, TB 500. So that's BBC 157 is dosed at about 300 to 500 micrograms. Is 0.1 microgram per kilogram is the recommended dose, but you can go above that. And 1 milligram of TB 500 daily, and you're going to do that for 4 weeks on, 4 weeks off. So, and you can see how the effect is. So you're going to have in the recovery period, you're going to have it's long. So you're going to expect to do a few cycles of this, and the reason you cycle off of it is you want the body to relax a little bit with this. So the second medication I would use one of the growth hormone releasing peptides. Probably the most effective one is tesamorelin as a single medication. Tesamorelin is actually available over the counter. I have to look at the name. Agrifta is the name, and its indication is for AIDS lipodystrophy. So wasting removes fat. But it works. It's one of the best, most potent growth hormone releasing factors. So I would probably go with those two to start out with. I've got a couple of other things here, and I would tell the patient a couple of things. I want them to, I'm happy that you're doing that with the vitamin D, because I think vitamin D is super important. Magnesium, I think we're all there. There's so much magnesium deficiency, and because you're using something with calcium and magnesium basically are, you need calcium to help, or you need magnesium to help the vitamin D get the calcium into the bone. So it's like you want to make sure that you have plenty of that stuff in there. What else? I wrote some other stuff down. Vitamin D, DK. I mean, I'm sure that you don't have them. Do you have them do just regular vitamin D3, K2, or do you do just?
It depends a lot. So our typical is for 10,000 units of vitamin D3, but a lot of people are taking K2 as well.
Yeah. Okay. So I mean that kind of thing. And maybe a collagen peptide. You might want to throw that in there as a daily. Throw it in a shake. If they're not doing protein shakes, that works really well for that. You want to keep your protein intake high. Do you guys do dietary stuff with them too?
We do. So it's interesting. We had a talk about diet last time, and keeping it very simple. Without knowing anything about the patient, they're not eating enough protein. Take a gram per pound. They can't get too much. That's the basic.
It's really interesting. I saw this study either today or yesterday. I don't know where it was, but it was talking about protein and optimal protein dosing. Like how much protein can you take in at a sitting? Because I remember the Grow Life before it was like 30 grams.
Yeah.
They say like more than 100 now.
Yeah.
But that's what repair is all about, right? So and if you can chug down that much protein, that's fantastic, because the food that you're putting in is almost as important as anything else, because if you don't have those building blocks to make the bone and the connective tissue and just making getting that where it needs to be, that's you're going to have a major problem. Right. So that's
we're both chuckling because you just validated our last talk for 2 hours on nutrition, is that these are elective scheduled surgeries. There's no emergency here. You have all the time in the world to optimize yourself, whether it's hormonally or what, but everybody can afford to take more protein to get their diet on point, because none of this matters if you're not getting the right calories and enough calories.
Right.
So
absolutely.
It's hard to get enough calories eating clean. Eat a cheeseburger, don't lose weight, but you got to get enough protein, and you got to spread it out throughout the day. You got to exercise for general health. But
cheeseburgers are good.
What?
Cheeseburgers are good.
Yeah.
Especially if Dr. Robbins makes them.
Yeah, I don't know if you know, Victor is a natural bodybuilder, and Victor is on a 16-month cycle for the Worlds next year. So in space is all the bozo, I shouldn't say that, all the people who are not natural, who are taking all the other stuff too. So Victor is very involved and adjacent to the darker side of at least the injectable stuff too. So I don't know.
We talk more about that sometime, because that stuff is crazy.
Yeah. It is.
I mean, super interesting. The fact, this is totally has nothing to do with what we're talking about. But I love fitness, and I watch a lot of YouTube, these influencers, and I love now that everybody's like questioning whether somebody's natural or not.
Yeah,
like
natty or not. Yeah.
First of all, who cares?
Yeah.
And second of all, it's just like you can. I mean, you can't tell 100% of the time, right? But you can pretty much tell who's
You can, yeah. At least I can. I can
a little bit of help. You know what I mean? It's
and if they are taking stuff and they don't look like they're taking stuff, then I'm like, go eat. You know, like
Yeah, right.
it's all about eating. That's bodybuilding is eating.
It is.
The working out's easy. You just go in there and then you have to just do it hard enough and enough of it, and then if you don't eat enough, you're screwed.
You are. You're just
and the catabolism. I'm just go back to your surgery. The catabolism that happens from a surgical procedure it's huge. It's like it is such an insult on your body, and it's an insult by it's not insulting your body. It's an attack on your body that you need more than what you have at baseline to recover from that. So,
and what we like to say is, because we're not just healing a broken fracture, we're making a 3-inch gap and growing new bone. So we say we're growing a baby's worth of material. You're growing nerves and artery. You're not just stretching, you're actually growing. You're putting pounds of new material into your body. And
have you guys done any research on the caloric requirements of these people?
No. So it's a great question. We track weight, which is, is very basic.
Yeah.
But just, I'm telling my patients they need several hundred more calories per day easily. Quality of calories is important, but now it's easy. You can order Uber Eats to your hospital side if you want to, but anybody can get a protein shake powder or a weight gain powder. But the conversation starts during the initial visits. You got to think about what you're eating. You can't get up and grab a shake. You can't get up and snack. You lose weight, not just from the catabolic part, but you lose weight because you can't get enough calories in because you're not as mobile for the first week or two. So it's have snacks, bring them with you to the hospital, try to put on 5 or 10 pounds of good muscle in the months before because you're going to lose it pretty quick. But again, these are not sick patients with diabetes and multiple comorbidities or having a hard time healing a gastric bypass. They're relatively healthy people who have a lot of extra reserve in general. But why tap the reserve if you can optimize before this is elective? And so this is exactly the spirit of what we're talking about is all this stuff is great, but eat healthy first, because none of it matters if you're not at least doing the things that you can do.
Yeah.
So it's all synergistic.
But eating is much more boring than taking peptides.
It is. And that's what they tell me. They're like, but isn't this the magic injection? I'm like,
I just want to take peptides.
Like Cher said, if it came in a bottle or it came in a pill,
food injection.
Yeah.
So, it's interesting because it's Victor, you know this too. You work out, and that point where you want to try and get bigger, and that's like, and you're not using meds, and honestly, the drugs. First of all, the guys that are really great bodybuilders, we're going to talk about bodybuilders. They have great genetics anyway. They build muscle regardless. They're big no matter what.
Mm-hmm.
But the steroids help them out. And the problem is with what we have now is you have all these young guys that are out there and they're taking so much stuff that they don't need to take. You don't need to take that much. You're going to have a natural place where you're going to settle out, and if you want to push it beyond that, you take a little bit of stuff and you're good. But you don't go to a gram of testosterone a week. That starts to get a little crazy.
That's what they hear. They hear the gram of testosterone.
Everybody wants the trend.
Yeah, trend too, and a ball. It's crazy.
I told Victor that when I started going down the peptide rabbit hole, I went to Reddit first. So the first thing I'm reading, this guy is reading.
Nothing wrong with that. I mean, there's actually some decent information there.
Yeah. So the first thing I read is this guy, he's rattling off this cocktail, 6-7 things over this many-week taper. And his last thing after paragraph says, and oh, by the way, my wife has lost another 100 pounds. She's down to 400. I'm like, dude, you can give her all the peptides in the world you want. And let's be clear, good for her for losing the weight. And maybe it was
sure.
The point was she's killing herself with the weight. The peptides
Right.
aren't where she needs to spend her time and money. She needs to get fit and work on her diet.
That's bringing that all back around to what we were talking about. That is the key.
Yep.
These are all. Anything that we're talking about here today is a tool, right?
Yep.
A tool to help you get a goal, right? So, it's not going to do it for you. You know, some of it's going to help out because there's going to be a point in your recovery where you're going to need some help with some of the stuff. You want to make sure your appetite's good. Actually, testosterone increases your appetite, so it's good for that sort of thing.
Really good to know.
That is because appetite stimulants are. I know a lot of people.
And it's crazy because it's not what I know. My main thing with most of my patients, they're kind of trying to lose weight, right?
Yeah.
So getting on something that stimulates the appetite is not a good thing. But this is one of those things that definitely you want to do that, and you want to make sure that the counseling with before and during and even after, you want to make sure that the nutrition is really emphasized, and the medications and all the other stuff that we can do is all very helpful. It just is, it's this, you have this much, but they're like this much. You're just bringing it that much higher.
Absolutely.
Icing on top. What you eat. Food is medicine.
Food is great.
Food is
medicine. Yeah.
All right, Dr. Willis. So now we're going to talk a little bit about, you said this earlier, it's not going to take your recovery time from 12 weeks and turn it into a week, but you said it's going to make it optimized or more efficient. Do you have any anecdotal or any type of studies that you can kind of like quote or mention or recall?
I have no studies with this. And honestly, I don't know whether anything. I've done some scanning of the literature, but most of the tests, and I'm not going to go back to the amount of research done on these things. A lot of it's anecdotal, right? And a lot of the research is done on animals. So how much of it is helpful? How much does it decrease? Do you have like a double-blind placebo that says that it decreases your recovery by 3 days? No, I don't have anything like that. Gotcha. But what it's going to do is it's going to, and it might, it very well might if you put growth hormone and you put some anti-inflammatory type, angiogenic type of medications or some of these other medications, you might do better. How much better? I think it's going to be very individualized. I think you're going to, everybody's going to be a little bit different. I think some of the people that are older, I think are probably going to benefit more, because those are people that are going to struggle. They're going to struggle from the immobility. One of the biggest shocking things about hospitalization is how deconditioned people get so quickly. It's like a couple of days and you're just destroyed. But if we're trying to do this with these people, if we improve that, if you get the people, again, we haven't really talked about I haven't talked with Dr. Robbins about his protocols with what happens to people after the surgery. But I would think that, you got a period of immobility and then you got to get them mobilized. So we want to try and do the things we can do to get people mobile more quickly. This is, again, optimization. So we're not going to take, we may squeeze the timeline for recovery a little bit, but maybe that's going to come not from the medication so much but maybe it's because we can get into therapy quicker and you can push therapy a little bit harder. And, if you have motivated people, like, that are going into therapy, you're going to get better faster if you're able to do more in therapy. Right. So, that may be the thing that causes you to have a quicker recovery. And, if you come out on the other side and you are, your body is more whole, you're not as beaten up and destroyed the way you could be with the surgery, then that's also a benefit, because then your slope back into a normal life is steeper. It's like, so you're not just, not able to do things for a long time. So I don't have anything that's going to be specific for that.
Right.
But it's going with the optimization. If you're optimal, you're going to do better.
That makes sense. And who knows now? I think it's so new. It's so new that, we need patients don't need them, but once they start doing this, we'll get more data. So,
yeah.
All right. So we talked about this earlier about the combining the therapies.
Yep.
You said that that's going to be better. But I know you wanted to mention some other peptides that I didn't have in here.
Yeah. So I did a couple. I did an overview, and there are so many peptides available now that it's mind-boggling. If you go on, I'm gonna say a website because they have a lot of peptides, and you can look on there and you can see everything, which is called Peptide Sciences. And I've used them. They seem to be quality. I have no affiliation with them. I know nothing about them. I just know that they have a slick website that has a lot of information about the peptides. So, but there's a couple of things that we've used that with some of our clients that I was like, I wonder how this would work. So I looked at some of the research, and it was very interesting. So particularly two additional ones, something called GHK-Cu, which is a copper peptide. We are using it, believe it or not, for hair growth, but it's also been shown to help with wound healing. So again, is it going to help with the actual surgery or recovery? It may or may not, but it make a stronger surgical wound, which may be better in the long term. Very interesting peptide. It does a lot of stuff with collagen and with I think the hair thing is crazy. It works on it proliferates actual hair follicles. So it's like this there's GHK-Cu is in a lot of topical like hair tonics that you can get at different places, but injectable, it's a different game. But very interesting peptide. And then the second
one could use that, Scott.
What's that?
The three of us could use that.
Oh yeah. It's great. We can just throw it on. We'll be the guinea pigs for it. So we have a couple of clients on it right now. It does amazing things. The last one is something called DSIP, which is it's affecting something that is going to help you recover, which is sleep. So it's called Delta Sleep Inducing Peptide. It's can be injectable or in through a nasal spray. And the studies have all shown that it increases the amount of delta sleep. So that's deep sleep, not REM sleep, but the deep restorative sleep significantly. Have a couple of clients on that, and it is a game changer for them, like people that have had like insomnia that can't sleep. So again, maybe something that you want to think about.
That's huge.
It's huge.
That's huge.
Which is everything.
It's important for healing, recovery, psychological well-being. Good sleep complaints are a huge complaint. This is a prescription thing, or is this is an over-the-counter?
Again, it's it's compounded. You have access to it because it's compounded. Actually, I think the one that we have available to us is a spray under your tongue.
Sublingual. Yeah. That's interesting. That's really, I mean, I don't sleep enough for bodybuilding. It's huge. So maybe I'll look into that. But
my new Garmin scores my sleep, and I pretty much suck.
That's because you're running to
every day. I wake up here what a loser I am. You suck at sleep. Good luck with your day. That's basically what it says.
Yeah. So that's pretty much it. I think that. Let me talk about one other thing I came across. MGF-PEG, which is mechanogrowth factor. Mechanogrowth factor could be a amazing addition to the recovery for surgical patients. I kind of just skipped over this one, and there are more than one study out there which shows that it increases bone healing. So it accelerates bone healing. And it does this. Mechanogrowth factor is something that actually you produce in your body that causes proliferation of osteocytes. So you basically have more bone cells. It doesn't work in the same way as the other medications that are used for osteoporosis. But what it does is it allows you to optimize again the amount of osteoblastic activity, which is the which is laying down new bone. So if you use something like this, theoretically it would help with the healing and development of new bone.
Wow. So that could be something that they look into in the consolidation phase once lengthening is done. Now, I wanted to ask you and Dr. Robbins to kind of like maybe have a little overlap or crossover of how patients are thinking, okay, I'm lengthening, and obviously we don't want the bone to heal too quickly because of a premature consolidation, but would it be better for them just to wait till the consolidation period or the bone healing phase, Dr. Willis, and Dr. Robbins, would it be dangerous?
I don't know how much, Scott. So Scott, basically, you come to me, you want to be 3 inches taller. I put a rod in your femur that has an 8 centimeter or 3.1 inch excursion. We wait 1 week after surgery. We call that latency. And then we distract you 1 millimeter per day over 4 different sessions. So it's 1/4 of a millimeter per day, 1/100th of an inch per session. So if you do that for 80 days, you get 80 millimeters is 3 inches. So along the way, we're checking your x-ray and we're looking for bone regeneration as we're distracting across the gap. And that 1 millimeter has been studied for decades in the femur. It's good. It's not too fast that the bone pulls thin like taffy. It's enough that the nerves don't get too stretched, and most people can tolerate that. So for 3 months, you're creating a gap. Some people make nice bone during that. But once the lengthening's done, we now say you're in consolidation phase. So now is when we're watching for the bone to come in like gangbusters. So
that's where this mechanical growth factor would be useful.
Gotcha.
You would be laying down bone more quickly with that.
Gotcha.
Okay.
The good thing is about all these peptides that I just mentioned are all on the list.
Oh, they're all on the base?
Yeah.
Of course.
You just said the sleep one too?
Yep. And I'm telling you, all the one, like if it works, if there is a peptide that's been developed that is very effective, it's on that list.
Oh my God.
I don't know why. I'm not going to throw my conspiracy theory out there, but just
feel free. I want to know.
No, I'm not going to get into that.
Today they are. Time will tell.
Yeah. Okay.
Yeah, we'll see. Right. You know, hopefully they reverse that, because it's silly. You know, it's like especially the BPC, because it's such a widely used medication that so many people have used it with excellent results, and there's no side effects. I mean, the biggest side effect is that it hurts to stick a needle in your arm.
So there's a barrier to entry, which is important, because if it's
there's a lot of people that don't like needles. They don't want to give themselves shots, which is understandable. But the thing that you try and tell them is that it's a 31 gauge needle, which is like your human hair, and it's barely detectable. But and it's always the guys with all the tattoos, man. They don't want the shots. So
I love it. And we talked about this a little bit earlier. You kind of mentioned your demographic of patients is typically older, and Dr. Robbins young and healthy. But would you say, we kind of talked about that, so we'll kind of skip over that, I guess. Challenges and misconceptions. So this is kind of a slide that, I put in there of, we just talked about your list, or I wouldn't say banned list, but the list of the FDA's kind of like putting a highlight red flag on them. But what are some of the misconceptions or challenges that peptides have going forward? Like, we know that they have benefit. They're, like I said, the new kid on the block. There's not a whole lot of data on them, but what can you speculate from what you do know that they might face in the next coming years? Because anything new is going to face, some turmoil.
I think, honestly, a lot. I mentioned, our new potential health and human services leader is, I don't know how much you know about this guy. He's a very interesting guy, and I think that he's going to bring some sanity to our medical system if he's allowed to do it. The challenges, are going to be getting the medications and getting them in a pure form. I think that's always going to be the thing that we worry about, because, if you can get them through a compounding pharmacy, you don't have to get them through pharma. That's not necessarily a bad thing if they are made available through commercial, big pharma, like Eli Lilly and those type of companies. It tends to make it more of a profit motive, and they don't like these things because they're not as profitable. They're not like a novel drug that they can put out there to cure cure cancer. But these things would help a lot of people with a lot of their daily issues, and I think probably that's probably the biggest thing is that they have to be made available, and they have to be made available in a way that you can trust that what you're getting. When we talked about it before, if you get it, you could get through some of these research chemical places and might have might get great results with it, but you just don't know, and that's probably the biggest concern. Misconceptions. I mean, I honestly haven't really met a lot of that because the majority of my patients are the weight loss patients. So their conception is, I want to lose weight. I'm fat and I want to lose weight, but they don't misconceive that. They know that what they're taking, and it is what it is. With the other peptides, I think that I think the problem is that there's a lot of noise out there, and nobody knows really. A lot of people are talking about it, but I think there's probably not a lot of authorities on it, and there's not going to be. I think that the authority is going to be more the people that use it more. There are some physicians out there that have been utilizing peptides in their practices for a long time, and I think that those are probably the best sources of information. My own, I'll be honest with you. My experience with these is nothing compared to some of these guys. And they do a great job. And there's actually some people that are non-physicians that are probably great resources for this as well. My initial, introduction to this was not physician. It was a guy that I heard about it, and like watching my, anti-aging or optimization stuff on YouTube, and I'm like, hey, that sounds kind of interesting. And I started learning more and more about it, and I tried to educate myself. And that's the doctors that are going to be at the forefront of this, which I said, and I know I'm not a guy that says that, doctors know everything. I just think that the only thing that the thing that I add to this is I'm interested in it, right? So I want to keep learning about it. I can monitor your health, which is good, and I can handle side effects. So, and I guess probably the third thing is I can reel you in from, doing stupid shizzle on your own, because that's the other things, if the misconception, if this much is good, that much is better. So it may not be that. So, down the road, I think that we're going to have more and more of this. I think that medicine is, I actually think medicine is very exciting. I think that there's a lot of good stuff going on. I think that there is outside of what you guys are doing, I think that there is a lot of benefit to improving people's lives and their health through these kind of things. Because I think once people start getting more knowledge about, what is out there, and take more ownership of their health, I think that we're going to see a lot of improvement, because we have, we do, I heard something really interesting. We do really good at acute medicine in the United States. We do horrible at like chronic stuff. And we have a medical system that's based on chronic disease. It's basically giving you a pill to take care of your problem, which almost all the problems that we have in our from our health are lifestyle related. We could handle them with diet and exercise. So, this kind of stuff is good because people get interested in it, and then they get interested in other things. They get interested in nutrition. They get interested in, exercise. How do I exercise? What's the right exercise? What can I do to make myself, do I want to live to be 100? I want to live to be 100, but I don't want to do 20 of those years in a nursing home. It's like that. It's all about that. And I think that I think that's going to move us in a good direction going forward.
That's well said. Yeah. And I know Dr. Robbins and I were saying a few weeks ago on the nutrition talk that, for semaglutides and, people who are looking to do medical weight loss, somebody who's really overweight, maybe it's not the best thing for them to just use and say, oh, it's the magic injection. But hey, maybe this can kickstart seeing that weight loss.
I tell all of my clients, it's a tool.
Yes.
And you can, bariatric surgery is a tool too. Bariatric surgery is a tool that's permanent, though. That's the problem with it. And there's lots of potential side effects from it. Does it work? Yeah. Do people get around it and gain the weight back? Absolutely.
Yep.
So, here, you have to take ownership of your health. This is the only one, this is the only body you have. And
Right.
it's the only time you're going to get to do it, use it. And, it's great if you, realize that from the beginning and you are active and taking care of yourself from, the time you're young. But there's the reality is that, most people don't do that. We go to the gym and we look around and we think everybody looks like that, but everybody doesn't. And it's a tiny subset of people in our culture. And, it's, if we can get a few of those people moving along in the right direction, we were talking about weight loss. I'm an emergency room doctor. I see bad stuff. I mean, I work nights, so I see a lot of bad stuff, a lot of people that are, just bad.
Mm-hmm.
And then I do this weight loss and peptide and all this sort of thing through my telehealth business. And I think that I'm affecting more people in their health through this than I am through my regular job. It's like, I can't tell you how many self-destructive behaviors and bad outcomes from bad decisions that I see, on a daily basis. And I see these people that come to me and they're upset because I only lost like 20 pounds. Well, that 20 pounds probably just added 10 years to your life, So it's like, I'm happy with any of it. They want to look like a supermodel, or they want to have a six-pack, but that's less important and probably not as healthy anyway, you get that low of a body fat. But, it's interesting, it's a lot of it is about taking ownership of your body and your health.
So Victor, do you have more? Because I have questions for Scott.
Yeah, we have I think, let's see, it was just what we already talked about the future of peptides. He just kind of mentioned that. So go ahead, Dr. Robbins.
So you personally, Scott, how much protein do you take in? How do you eat? Do you eat a balanced diet, or are you on a other kind of diet?
I think that I've tried a lot of different things. I think that I will tell you, I took I got a little fat there for a while, so I took I took some semaglutide because I was pushing it on people, and I wanted to take it myself and find out how it worked. And it's funny because I learned something that testosterone, which I'm on as well, and semaglutide equals not as much weight loss as you would think. So and it's funny because I put guys on both, and they lose weight, but they don't lose as much weight as people that just are on just starving themselves. But the reason for that is because you're not losing the muscle. Right. So, so what do I eat? I eat a balanced diet. I generally eat twice a day, and I have a cookie here and there. I like cookies. I like cookies a lot. I don't drink alcohol. I think that I have gone more rigorous type of diets, but I think that right now it's just that I have the biggest sort of bad health thing that I have going on now is that I work shift work, and I work nights at the ER. So that probably is my biggest health concern. How long can I keep doing that? And I think that there's probably some evidence out there that says that shift work is bad for you, but if you only work nights, how is that really bad for you? I don't know. I think a lot of it just depends on who you are and how you take care of yourself. I try and work out 3 or 4 times a week, and I'm not doing anything special, but I just try and do general stuff. But yeah, that's pretty much it. Oh, yes. How much protein? Trying to get a gram per pound.
Okay, gram per pound. Yeah. Okay.
Solid.
I try. It doesn't always work out. And actually, that's a gram per pound of lean body mass.
Okay.
So that's what the numbers look like for probably optimal. And you probably can go way above that, but
I tell the surgical patients try to get a gram per pound. It makes the math easy, and they're post-operative.
Yeah.
So, and it's hard to do.
It is hard to do. I mean, and I believe that probably food is better than drinking protein drinks. Protein drinks are convenient.
Yeah, they're a tool like everything else.
Yeah, and we talk about quality, and the quality of the protein. The whey protein is made from milk. All of it's it's pretty expensive, and some of it is better than others. But I mean, it's pretty bioavailable. It's very convenient. But still, I think probably eating it is better. It's just that, it's hard to eat 100, if you're 200 pounds and you're 170 pounds lean, that's a lot of protein to eat. And it's, my stepson wants to be a bodybuilder, right? So he's tall, he's 6'2", and last week we did a breakdown of his diet, and I told him what he needs to eat.
Yeah.
He said, how am I going to eat all that? And I was only going into like a 200 calorie surplus.
Oh, geez.
So, I mean, it would have been, and he's like, how am I going to ever eat all that?
But back when I was reading all the muscle mags, like Mike Matarazzi, I remember him in the late 90s, 320 pounds, huge guy. He would set an alarm and wake up and eat a couple hundred calories. Like it's 24 hours. It's insane. 7,000, 8,000, 9,000 calories to bulk up. And then, Victor, where are you in your cycle? You're still a year out, or you're 10 months out?
I'm starting. So the diet kind of started. I'm really going to go hardcore in January, but I'm at 3,500 calories right now.
Are you building?
I'm maintaining.
Okay.
My building was at 4,000. Maintaining is at 35, and then I'll come down to 27 to start the cut. I'll do that for about 6 months. I'm 215. I'll come down to 175, so a loss of 40 pounds or so.
Wow. So is your competition, and I guess I have spoiler alert, because we're going to do an episode where I interview you.
Yeah.
What's your competing weight?
Last time it was 168. I think I put on about 5 solid pounds of muscle, and I'm not going to diet, to the point where I'm skin and bones. So
gotcha. Okay. So 170 something.
Yeah. The goal is to
but that's also, it takes that long to do that without muscle.
Yeah, absolutely. Yeah. And naturally too, because it's I love learning about this. My background's in biomedical science, so I love learning about all this stuff, biochemistry and whatnot. But obviously, we're WADA tested, so there's just certain things that we can't take. Peptides, unfortunately, is one of them. But
everything you're banned from taking everything. You can't take ABC.
No, but I did look into, and I don't know if you know about this, Dr. Willis, about what is it? Stem cell
exosomes.
Yeah, exosomes and it's a nutrigenic, is it nutrigenic, or like basically it's basically it's pills. It's what are they called? Anyway, they're like fruits and vegetables that are like digested, and then they are put into pills, and you take them. They're supposed to pretty much stimulate your natural stem cell activity in your body to help heal.
Yeah, I know about that.
Yeah. Okay. All right. Interesting. I talked to a doctor. He's a PhD guy, and I'm supposed to interview him as well. And he came up with saying it helped. It was from like the salamander or anything. Going off on a tangent. But anyway, very cool. This was a great discussion. So Dr. Willis, do you guys in the chat have any questions for Dr. Willis? Let's see here. We're going to do a live Q&A really quick. They always ask about limb lengthening. So this question here from AK, can you ask the docs about Voxzogo for young people still growing without achondroplasia?
No,
Dr. Robbins,
no. So in our practice, and you can look him up, he's now, where's Aaron in St. Louis? Aaron, Aaron Hughes, or Huser. He was our Voxzogo go-to person here at the Paley Institute. So he probably has the most experience with it. I have no experience with it. Even in our achondroplastic patients, he was part of the managing team for that. So apologize, I don't have an answer for you.
Gotcha. This next one, I
haven't even heard of it. I didn't go look it up.
I neither. This one you could probably answer, Dr. Willis, about testosterone injections. to force start puberty earlier to help them?
These are endocrinology questions.
Yeah, they are. That for sure is but that's what they do. Growth hormone, because testosterone is going to give you a secondary male sex characteristic. So it's going to increase body hair and stuff like that. Start them having smelly armpits and stuff. Whether it increases the height, I'm not really sure, but basically, if you're going to be growing, you have a short stature child, they do qualify for, of course, there's parameters of this for growth hormone therapy, and really, that is the indication for growth hormone. That's it. If everything else you're using it for is off-label, so it's, it is what it is. We use off-label stuff all the time, but testosterone probably not. Growth hormone, yeah.
Got it. All right. Let's see if there's any other questions in here. This one's about Adderall killed my appetite. So you said that one, was it Cimarelin that stimulates the appetite?
Yeah. I mean, anything that is a ghrelin stimulant, it will increase your appetite.
Mm-hmm.
I don't know in terms of using it with Adderall. Adderall for sure is going to kill your appetite, for sure. I mean, it's like phentermine. Phentermine is another medication that is used frequently in weight loss, which is another one of our and I was going to say methamphetamine, amphetamine derivatives. So yeah, the FL ADHD, man. Yeah, that's true. There's a lot of stuff we can do there, but yeah, Adderall will ruin your appetite. And whether there's anything you can do peptide wise to do that, I don't know. I don't know in combination.
Got it. The contraindications might be something. Yeah. This one, I don't know if Dr. Robbins, you want to answer any limb lengthening questions? You want to just wait till next?
Yeah.
All right. So this person's asking, how does limb lengthening surgery affect someone as they get older? So if they have the surgery in the 30s, what might happen in the 60s, 70s?
So all I can do is quote my senior partner, who's been doing this for nearly 40 years, and quite literally tens of thousands of patients have had limb reconstruction, not tens of thousands of stature lengthening. To our knowledge, there are no ill effects. I ask my patients this: would you trade height for function? And I don't mean like the ability to walk or run, but if you run an 8-minute mile and after a height lengthening, you ran an 8:30 mile, would that affect you? And the answer is no. These people are so dedicated to height, they would give that up. The height is that important. So, and I don't ask that because that's what happens. Let's be very clear. I'm asking, there are what's the phrase? There's no solutions, only compromises. So to our knowledge, we're not creating any long-term effects. And George's been doing this for a long time. So by now, if his patients 30 years ago were having problems, they'd know he's still around. He's easily contactable, and a lot of patients follow up with him. So sort of anecdotally, that's his answer. But it is a valid question, and you are changing your life. What's the problem of having silicone injected into your face, or these fillers or breast implants for 30 years? Well, I guess total hips and things like that we know, but there's a lot of other things that are augmenting bodies, and some of them we have answers to, and some of we don't. If we thought or knew that there were long-term problems, then obviously wouldn't be asking it. The one we're asked the most about is arthritis and stuff. And arthritis is so multifactorial. If you're very heavy and you're predisposed and your parents had it, you're probably going to get arthritis, all things being equal. But if you're young and you're fit and you're active and you didn't play tackle football for 20 years and you're not doing these crazy things, then you're probably less prone to get it. So it's interesting, but our patients in general who do our stature lengthening, it's a very interesting group of patients. One, they tend to be well-educated, if not formally in the education system. They're just really smart. They've done their homework. They know what they're talking about. Most of them have a real interest in their health and their general well-being. So they're going to, it's a subset of people that are probably going to do okay anyway, health-wise. Very few of them have weight problems, like they're doing it right. So it is a great group of patients to work with because they don't have the typical problems like Scott sees that roll in the ER, 20 people coming in the ER in the middle of the night, and 18 of them are probably on 10 meds or more, as a guess. Mine are not. So most of these people are living right anyway. But long-winded answer, we don't think there's any long-term problems for that. That being said, this is not something to do just because you can. You have the money, you have the time, you think you can do it just for points. This is a big deal. We're talking about breaking bones, stretching things. The potential problems are huge. Fortunately, they're very rare, but if it happens to you, it's 100%. So I say this all the time. You don't go into this very lightly. You got to do your homework. Interview me, watch Victor's videos. This is a gigantic life decision for many reasons.
Absolutely. Well said. All right. And I just want to let Dr. Willis, so for anybody that wants to reach out to you, how can they contact you?
Well, you see, if you look at the bottom of the screen there, it looks like our website is just going by at warp speed there. So yeah, we have a website, it's maximummedical.net. We can be contacted through that. There's also some phone numbers for contact on there, and there is a scheduling portion of that too. If you want to talk to me, so we can do that as well.
Very cool. And this would be for anybody that's looking to maybe get into medical weight loss, or would you be able to help them with like educating them a little bit more about peptides as well?
Yeah, I like talking about this stuff. So it's like, obviously I have some things I need to do otherwise, but I sit there on the phone or sit there on a telehealth visit and talk to you about it all day long.
Sounds good. Awesome.
Maybe not all day long, but
And then the last comment here says there's going to be all kinds of people talking about peptides on Reddit now. That's crazy.
Yeah.
But yeah.
Probably. Good. Okay. Because conversation is good.
You gotta love the bros.
I know.
Right?
That's how it is. But anyway, I want to thank you, Dr. Willis, for coming on and giving us this peptides masterclass. I mean, literally, I knew next to nothing, and you just gave me a good fundamental background on it. So now I can kind of, understand what I'm saying to patients now. And Dr. Robbins has a better understanding as well. So this is a new area. I think it's exciting. And like you said, the future holds a lot of potential with this stuff. So we'd like to have you come back on. Like Dr. Robbins said, I believe once a quarter, maybe biannually or whatever. Just like if you get any new updates or you go to seminars and stuff, just to update us. That's really helpful. So
we're looking for one to go together, to hang out and learn together. So
yeah, cool.
We talked about that already. So just give me some time. We'll figure it out.
Yeah. And so Scott, I don't know if you could tell, I was petting Marshall as my big Great Dane. It's his feeding and poop time. So he's been hovering around. So we usually talk about my dog. And then Victor asks me, because I cook a lot, what I've been cooking for the kids and stuff. And he asks me what books I've read. And I
had to mute myself because the dogs were howling.
Yeah.
They have this thing where they start together and they build in this crescendo of like it's ridiculous. But so I had to wait them out. They stop after a while.
So Victor asked Scott if he's reading or podcasting or what he do to fill his brain and expand his mind.
Right, Dr. Willis, what new things have you read? It can be a book, article, research, whatever you want to. What have you delved into recently?
What's your non-medical passions?
Yeah.
Well, I'm going to say this. I have this weird love of gym equipment.
Oh.
And I don't know where it came from, but I love gym equipment. I love it. I watched this guy on YouTube. His name it's called Domination Nation. The guy is a podiatrist. He lives in Ohio someplace, and he has a 10,000 square foot metal barn full of gym equipment.
Wow.
And he is my hero. I don't know what else to say, but he's got like everything, like all these and it's not like, it's not that I don't know why it is that I like that, but it's like this guy, he tweaks these machines and he puts different weight horns on them and different handles. And it's just like, he's super smart when he looks at this stuff. And I don't know. I love this stuff.
You reached out to him? You should go visit him.
Yeah.
I put a contact there today. I was like, bro, I need to see your gym. I need to come and work out in your gym.
Right. So a lot of people don't know Scott started out in podiatry school.
Wow.
Yeah. And I remember, so we were in medical school together. We were roommates. And I remember, and I was so enamored by like Scott Willis is so cool, not just because back then he had long flowing manes of hair. He really was much better looking back then. Sorry, Scott. He was like a brunette Fabio. I mean, he was gorgeous. But what impressed me,
You scare me a little bit when you talk like that.
I mean, in a good way. Yeah, I was an English major. I just like medicine and all that. Scott was like, podiatry school was so hard. They would have a bag with bones, and we'd have to reach in and tell you which foot bone it was. And I was like, that's the most amazing thing I've ever heard. I could probably do it.
Crazy stuff.
That's crazy.
A long time ago.
Yeah,
wow. You said you knew him for like 27 years. That's crazy.
Yeah,
That's a long time ago.
actually, I guess so. 95. So when that would be almost. It's like. Dude, that's like almost 30.
That's almost, yeah, that's getting up there.
29 years. That's a long time, man.
Wow.
I married Scott and his first wife. I performed their wedding ceremony in the Keys on a boat.
Wow.
You sure did.
A long time ago.
Go way back, way go. But no, I mean, you're talking about this guy with the gym equipment. I'm a big fanatic about when I go into a gym, within a minute, I can tell you, can I work out here or not? And like, obviously, because I work out at a very high level, I need to have a certain type of equipment. But if it doesn't, I'm like, oh, this gym's trash. Like I got to bounce. So that's cool.
Where do you train?
I train at in Maryland, in Baltimore. It's a place called Exile Fitness.
What's it called?
Exile Fitness.
Okay.
A lot of celebrities like the WWE superstars. Jesse James West, he's a big YouTuber. Yeah. He lives in Maryland. He comes here a lot. So it's like the best in I'd say arguably probably East Coast, one of the best.
I used to live in that area. Where exactly is it?
It's we're in Rosedale, like on right on Route 40, Pulaski. Okay. Yeah, it's on the east northeast. But yeah, it's a great gym. I'm training there. Like Dr. Robbins said, I'm competing in natural bodybuilding next year. OCB Yorton Cup. I'm gonna come take that title, so we'll see. I'm gonna start documenting them, get back on Instagram and all that good stuff. So, but I'm not gonna hold you up any longer, Dr. Willis. It's been a pleasure, Dr. Robbins, as always. So we'll have to have you back. It'd be great. Yeah,
it was a lot of fun. It pushes me too, because it's like this is stuff that I'm very interested in. Almost as much as gym equipment, but not. It's stuff that I think is. Like I said before, it's like there is way more helping people through this than there is through what I do normally. And it's, the thing that I'm always blown away by is this, being able to reach people this way. And, I'm sitting in my office in my house, but the reach is just so much greater. And,
Do you have a YouTube or any social media?
I don't.
You should start one, and I can give you the copy to this video. You can put it out there and say, "Hey, peptides," and you can just start doing gym equipment or whatever. I'd be happy to do that.
All honest and Victor.
And then right afterwards, we have a steak.
Right, Dr. Robbins will cook.
One day we'll take it down here. All going to get together and work out and eat.
That would be awesome,
dude. I will tell you, there will be nothing that would make me more happy than that.
Right.
We're the biceps. So.
All right, next time you come, right?
All right. Yeah, there we go. I love it.
Nobody saw that, did they?
No,
right.
Only the
all right, only like 4 million people. All right.
I know, right? But anyway, all right. I want to thank you guys for watching in the chat, and Dr. Willis for joining, and then Dr. Robbins. And I want to wish everybody a happy holidays. We'll see you in 2025.
Thanks.
So, awesome.
Bye, guys.
See you, Craig.
Yep.